Heart failure is a major burden on healthcare globally, with around 21 million adults worldwide living with it. In India, almost 1% of the population, or about 8 to 10 million individuals, suffer from heart failure. Welcome to the series on ATTR-CM. While heart failure results from ischemic heart disease, hypertension, rheumatic heart disease, endomyocardial fibrosis, and anemia, there's another cause that is under-recognized and under-diagnosed: transthyretin amyloid cardiomyopathy. In many patients, ATTR-CM is often confused with and misdiagnosed as blood pressure-related heart disease.
In this disease, there is some abnormal proteins which are deposited in different body organs, and in this condition it's mostly the heart, and sometimes the nervous tissues could also be affected. So once this abnormal proteins gets deposited in the heart muscles, there is thickening of the heart muscles, and this can give rise to heart failure. If there's deposition in the conducting tissue of the heart, then that can cause disturbance with the rhythm, and there could be arrhythmias, rhythm problems, heart blocks and all. And sometimes these tissues can get deposited on the heart valves and leading to a narrowing and thickening of the heart valves, such as a condition called aortic stenosis.
A high index of suspicion is mandatory to diagnose this disease. Early diagnosis is critical for efficacious treatment, and the earlier the diagnosis, the earlier the medication can be started to stop further deterioration of the patient's condition.
So if you had an echocardiography, for example, for some reason, and then your doctor finds that there is a thickening of your heart muscles, which cannot be easily explained by any other reason, then he may wish to do some tests, and such as, apart from usual ECG and echocardiography, they may wish to do a cardiac MRI, a special type of myocardial perfusion scan, where they actually look at the heart muscles and how they are perfused. So if these tests show that there is ATTR cardiomyopathy or an amyloid cardiomyopathy, then they may start you on a medication. As this medication, we know now, not only slows down the progression of the disease, but also reduces mortality.
This is important as while the ATTR-CM is not curable and existing amyloid deposits cannot be reversed, medication can halt disease progression by slowing or stopping the buildup of new protein deposits in the heart and other organs.